I'm Jack Kupferman, president of Gray Panthers NYC, and most of you know what Gray Panthers is over the course of decades, and our mission statement is activism and advocacy against ageism. Over the course of the past couple of years, we've been focusing on long-term care and most specifically on the issues of nursing home in the time of COVID. That obviously then becomes about nursing home reform and transformation. After we did our documentary on honoring nursing home lives lost, we started a webinar series that we call Transformation Tuesdays, which is to explore, to look at underappreciated aspects of nursing home reform and transformation. We've had a lot of success and a lot of new people who are understanding a little bit more what all of us on this call understand, that this is something that is essential and that this is the moment. Today's webinar, which is Greed Over Care, Financing of Nursing Homes in New York State. This was our topic because there's a lot of stuff going on here in New York State right now with regard to nursing home reform. There was a whole suite of legislation that's been enacted but not yet implemented. So we want to be able to push the governor to implement the suite of legislation, particularly with regard to safe staffing and the percentage of revenue that has to go to direct care, to do it immediately. Let's not wait. It's been too many decades too long. And also there was pushback from the industry. We're also going to be exploring what happens in how are nursing homes financed, private equity, nonprofit, for-profit. What does that mean and how does that impact the quality of the care? And what does that mean for the direct care of the individual residents? We have a great panel. I mean, this is kind of a dream team panel. And we're going to be starting off with Lindsay Heckler from Buffalo. Hold on one second. Lindsay is up in Buffalo, and I just had her bio, so I apologize, I don't have it in front of me right now. But she's been on the forefront of this issue and all other issues with regard to long-term care from the legal perspective. She is a supervising attorney for the Center for Elder Law and Justice in Buffalo. She's been on top of this, and she's been one of the key players that makes a difference in all of these issues. And we're really thrilled that she's doing it because she gives not only an upstate perspective, but a whole state perspective. And of course, we're looking forward to her presentation. Then we have the Eric Goldwine and Haley Kroonquist from the Long-Term Care Community Coalition. Unfortunately, Richard Mollot, who is the executive director of the Long-Term Care Coalition, is not able to join us today because he has COVID. So they are the prime educator for and research fund with regard to long-term care, both New York State and nationally. And every report that they do is very carefully drawn, researched, and makes a big difference. Then our third person is Sam Brooks from the National Consumer Voice. Sam is, hold on one second here, sorry about that. Sam is Consumer Voice Program and Policy Manager. He's an attorney formerly with the Aging and Disability Unit at Community Services in Philadelphia. He became an expert on nursing homes in Philadelphia and nursing home regulations. Sam has a passion for justice and years of advocating on behalf of nursing home residents. And, you know, this is one of the things that it's a very narrow topic, but we haven't been able to find people who are passionate and know what they're talking about. Then finally, we have Marissa Espinoza. Marissa is a student at Brooklyn Law School, and she has been doing research, academic research on the underpinnings of financing of nursing homes in New York State. And she's writing a couple of law review articles now. She graduated from Hofstra. Then after that, she did a Fulbright in Ecuador. She works full-time in the New York State government and attends Brooklyn Law School in the evening. She has a number of honors from Brooklyn Law School and is working on 2 law review articles on nursing home public policy, which will be published later this spring. Frankly, I'm really thrilled that we have all these people here, and it should be quite enlightening for everyone. So without too much further, I'd like to, and before we go, I want to acknowledge Wendy Brennan from Senator Liz Kruger's office, that she's joined us, and then Shelby Ventura from Council Member Althea Stevens' office. So we want to make sure that we understand that we do have partners in the legislative arena. So without too much more, I would like to ask Lindsay to start with us.
All right. Thank you, Jack. And thank you, everybody, for your time today. It's really exciting to see the interest in this very important issue of addressing resident quality and care concerns. So my part of the panel is to discuss some of the new laws in New York State surrounding transparency as to how nursing homes take the money that they receive, where they're supposed to provide quality care and services to every resident. What do they do with that money? How it is used? Before I get into that, and I have included as a handout for informational purposes, during the 2021 legislative session, a whole multitude of new laws were enacted with the goal of addressing longstanding issues in our state's nursing homes. These issues of insufficient staffing, subpar quality care, related party entities, and business transactions existed long before COVID. So during the 2021 session and ongoing, New York State enacted a multitude of laws, including which the safe staffing minimum standards, which are not currently being enforced through executive order, minimum direct care spending or medical loss ratio, which I believe Marissa is going to explain a little bit more on, publication of nursing home quality ratings, CMS star ratings, infection control, and many others. So I encourage everyone to take a look through the handout where we summarize the new laws currently. And if anybody ever has any questions, please don't hesitate to reach out. There are also some current movement during the budget process, which I'm happy to discuss outside this presentation. So why are the transparency laws in New York important? So I want to, before I go into examples, I want to explain what the laws are and their purpose of helping assist in transparency, not only residents and their representatives, but the long-term care ombudsman program, which are nursing home resident advocates, and the State Department of Health, which is the enforcement entity charged with making sure that nursing homes are actually meeting the minimum federal and state quality care standards. So the first law I want to talk about is specifically Public Health Law 2829, which are the nursing home disclosure requirements. Every nursing home is required to post their maximum rates to be charged for residency and services on their publicly accessible website. Now, as part of that, The website is also supposed to list all of the owners and disclose the name and business address of any landlord of the facility, on top of providing a summary of all contracts for provisions of goods or services. And this needs to be updated within 30 days of execution of any agreement or contract. And I have an example of why that's important. The other law I want to talk about, specifically, it's in for those who are interested, Public Health Law 2803X, which sets forth the disclosure requirements of related party contracts and business associations and operations. This law requires that any common or familiar ownership has to be included in the residency agreement. Now, these residency agreements are supposed to be on the nursing home's publicly available website. That has been a law for a couple of years now. However, if you were to go to, for the most part, any nursing home, pick one in the state, the odds of them having a copy of their admissions agreement, residency agreement, are pretty slim. It's something that's not enforced and needs to start happening. As part of the related party disclosure requirements, nursing homes are required to notify the Department of Health and the Ombudsman program of these common related contracts and associations. Included in that are management contracts. In addition, prior to entering into any new common or familiar ownership or contract, the operator is supposed to notify not only the Department of Health and the Long-Term Care Ombudsman program, but residents, their representatives, and the staff. A quick example of why that's important, I'm going to focus on the management contract. Now, when a nursing home is looking to sell, it's a very long process. The prospective operator has to submit what's called a certificate of need application to the Department of Health. Now, that process can take a while. So what tends to happen in our experience in Western New York is the prospective owner enters into a management contract with the current owner. So the prospective owner, during the process of going through the certificate of need to be formally approved to buy the nursing home, is in effect running the nursing home. This has some quality of care implications for residents. So an example we had with a client just prior to the pandemic, we had a client who did not have any issues with the incontinent briefs supplied by her nursing homes. However, the current operator entered into a contract with the prospective operator, and pretty quickly after the prospective operator took managerial control of the facility, that entity switched the company that provided the incontinent briefs. Our client all of a sudden started having concerns with the quality of that product. Upon further investigation, it was revealed that that new continent supply company had business relations with the entity managing the facility. So how these contracts are in play, who is a part of these different management companies and related entities, if they're directly tied to quality of care. Now, I do want to switch gears to the importance of transparency when the nursing homes are reporting information to the Department of Health, which currently is done via cost reports. Now, the Buffalo News recently ran an article on January 11th of this year on this issue. In that article, the news reported that in 2019, 72% of for-profit nursing homes in New York did business with related party entities. Transparency matters. Now, the article focused on 2 nursing homes. I want to focus on one because I don't have a lot of time. The nursing home I'm focusing on, Sapphire Rehabilitation of the North Towns, is a 1-star facility where over the past 3 years, they have been cited 103 times compared to 23, which is the statewide average, 103 to 23. Most recently, they were cited for immediate jeopardy status when in February, a resident was found dead outside directly below her third floor window. And upon further investigation, it was found that multiple resident room windows could fully open. And as a side note, one of the operators of this nursing home was also the operator of a nursing home that was closed just before the pandemic for quality of care issues. One of the more publicized issues that happened at that now closed nursing home was when a resident fell to his death through a window. Now, if an operator has sister facilities or entities that are related, you would think they would implement quality controls and make sure every single window in every single one of their other nursing homes has the window stops. That did not happen apparently, and now a woman is dead this past February. In November, this facility was cited for the failure to provide appropriate dialysis care. When interviewed, the registered nurse told the Department of Health that they worked full time, and yes, it was their responsibility to monitor the resident daily. However, quote, some days they had too many tasks and they did not have time, end quote. Staffing matters. This nurse, whose career is taking care of others, cannot do her job. Staffing matters. Nursing homes need to be held accountable to spend the funds they receive on resident care. Going to the cost reports in greater detail now. Per the Buffalo News that analyzed Sapphire North's cost reports from 2019, they found that a related entity listed in the report, Floral Agency, which is a staffing agency, made over $1 million of profits in 2019. Now, the cost report doesn't identify who owns the Floral Agency, only that it's related. Their cost report also indicated that it's a business with another related entity, which was an accounting and data processing company that made a little over of $300,000 in profits. Further investigation by the news revealed that one of the nursing home's owners is connected with that data processing company. In addition, the report details that the Sapphire North owners paid over $700,000 a year in rent to Sheridan Drive HC LLC that owns the nursing home's building and property. After expenses were deducted, that entity made just over $75,000. The takeaway here, Sheridan Drive HC owners include business associates and family members of Sapphire North nursing home owners. Related entities. This is where the money is going. Now, as I go to a close, the new laws that were implemented in 2021 are meant to improve quality of care. The nursing home industry are opposed to this in part because they claim they don't have money. My response is always prove it. And these two New York state laws are a step in the right direction of proving it. Show us how you are spending your money, right? However, in order to achieve this goal of having transparency to be used in improving quality of care, some things have to occur. Related party transactions are buried in cost reports and are only available via FOIL requests or through use of challenging to understand data sets. DOH not only has to streamline this information on its website for public information, but they also need to implement guidelines for the new laws through regulation, such that nursing homes are clearly required to disclose their various business transactions and relations. In addition, the Department of Health has to use this information in its enforcement and oversight obligations. As recently reported by the State Office of the Comptroller, while there was a focus on infection control and COVID, the Department of Health is not doing this. The Department of Health has this information, but they're doing nothing with it. So for example, going back to the example where a resident in Sapphire North fell to her death, and a now closed facility had something similar happen. why wasn't the Department of Health conducting a complaint investigation or inquiring to the other nursing homes in the sister chain to make sure the windows couldn't be fully opened? That should have happened. In addition, the Ombudsman program has to now be notified of these related party transactions and other contracts, including the management contracts. However, the Ombudsman program has been substantially underfunded in years. In order to fully implement the intention of these transparency laws, the state needs to fully invest in the long-term care ombudsman program such that they can have staff not only to meet with residents, but to look at this information and use it in their advocacy. For example, when an entity all of a sudden switches the incontinent briefs product, they can look into and say, oh, funny, this is owned by your husband, for example. So with that, I'm going to wrap it up with a call to action. Transparency matters. It is time the Department of Health starts doing more with the public transparency requirements, not only with enforcing what these nursing homes are supposed to post online, but taking a deeper dive into the data it has with these related contracts. And the Department of Health and the governor needs to start enforcing the laws that are on the books, not only the minimum direct spending law, but also the safe staffing minimum. So with that, Jack, I'm going to turn it over to LTCC.
Thank you so much. But before we go, I wanted to acknowledge that we have a number of other legislative staff members here. We have Monica Miranda from Assembly Member Jackson's office. She's the legislative director. We also have Ingrid Gonzalez, who works with Rachel May, who's the chair of the Senate Aging Committee, New York Senate Aging Committee. And I also wanted to make sure that we welcomed David McNally, who has become extremely active on the issues of nursing home reform in New York State. He is, I believe it's community affairs or advocacy for AARP in New York. So I'm thrilled to be able to turn this over to Long-Term Care Community Coalition.
Thank you, Jack, and thank you for inviting LTCCC to participate today. As you mentioned, Richard is unfortunately unable to join us, but we are happy to take over for him. So I am Haley Cronquist. I am LTCCC's policy attorney, and joining me today is Eric Goldwine. He is our policy and communications director. LTCCC is a nonprofit, nonpartisan organization dedicated to improving care and quality of life for the elderly and adult disabled in long-term care. We are also happy to be the home of 2 local ombudsman programs in New York. Our work is done through policy analysis and systems advocacy and education for consumers and families, ombudsmen, legislators, and others. And you can find our information and free resources at nursingHome411.org. So just a little bit of background about what we're going to discuss today. The Nursing Home Reform Law was passed in 1987. It is focused on and emphasizes individualized patient-centered care, and it lays out specific resident rights. Every nursing home that participates in the Medicaid and Medicare programs agree to meet or exceed the standards that are laid out in the law. And it is important to note that participation in Medicare and Medicaid is voluntary. If nursing homes do not wish to meet the standards laid out in the reform law, they are free to run private facilities without government funding. So as you just heard, the reform law that was passed in 1987 is strong, and it is in favor of good quality of care for nursing home residents. But if that law is so strong, why are nursing homes not decent and safe places to live and work? And the answer to that is that the reform law and the standards can only make a difference in the lives of nursing home residents if they are enforced. So our 2021 big project was focused on oversight and enforcement. We published 2 pieces. I'm going to start with the first one. It's a guide on the expectations of state agencies. State agencies are responsible for overseeing care in nursing homes and responding effectively to complaints about care. And then Eric will discuss our report, which is titled Broken Promises. Go to the next slide. So again, the expectation, we are going to explore the state's role in nursing home certification, surveys, enforcement, and more. Nursing home surveys are the principal mechanism through which nursing home quality is assessed and compliance with standards is determined. So we published an 86-page guide that highlights key sections of the state operations manual that we think are important for residents, family members, advocates, and others to know to help support their resident-centered advocacy. We focused on the chapters of the state operations manual that are related to nursing homes. So what is the state operations manual? It is a federal document. It's issued by CMS, and it contains all of the survey and certification rules and guidance for nursing home surveyors to assess whether or not facilities are complying with the regulatory requirements. It is 10 chapters long. It's more than 1,000 pages. It's really robust, and it covers more than just nursing homes. It covers hospitals, labs, and others. But again, we focused on nursing homes. Next slide, please. Thanks. So our guide covers guidance on 6 categories. The first is program background and responsibilities. So this is the basic role of certification in ensuring that nursing homes are meeting the specified requirements. The second is the survey process. So this is the how-to for nursing home surveyors. They have to follow protocols and guidance, and this helps them to do that. The third is state oversight performance standards. So this category covers the requirements that state agencies must meet. Enforcement and remedies is all the enforcement and remedies that are put in place by the state and/or CMS when facilities are found to be out of compliance with the federal requirements. Civil money penalties, that's one of the remedies that can be imposed on a facility. And then lastly, information disclosure. So this section discusses the survey and certification information that must be disclosed to the public. Next one, thanks. So this is just an excerpt from the guide, so you can see kind of how the guide is laid out. This is the survey process section. So it covers the team size, the survey frequency, conflicts of interest, the complaint and incident process, the different types of surveys and how they're conducted, and the actions that are taken when a facility is not in substantial compliance. So we really hope that this guide is useful for residents, family members, other advocates in knowing what to expect from state agencies. And I'm going to hand it off to Eric now to discuss the reality of the oversight system.
Thanks, Haley, and it's great to be on this program. And just to rewind a little, our website includes all of these sections at nursinghomes411.org. Haley will post it in the chat so you can. It displays everything in an organized way, whether it's the conflicts of interest section or the survey team or composition. You can really dig in. But what you've learned from Haley is that there's a set of rules for our oversight agencies, rules about survey frequency, about conflicts of interest, about what to do when a nursing home is out of compliance. And these are designed to ensure that residents are getting the care that they need. These are the expectations. Now, I'm going to talk about the reality, that is what's actually happening with nursing home surveys and enforcement. And this is based on 290,000 survey reports. So the report is called Broken Promises, an Assessment of State and Federal Enforcement Agency Performance. And I will discuss the results of this analysis of survey and enforcement data briefly at the state, regional, and federal levels. Just a note about the data. What we analyzed was a giant database of survey reports, 290,000 total citations. So that's roughly 97,000 per year. And each of these citations had an F tag. That is what category of nursing home regulation was cited, whether it's antipsychotics, resident rights, staffing, and what was the severity. So there's a scope and severity grid, A through L, where G or above is considered harm. and F4 below is considered less than harm. So this is a data-driven report, but it's important to note that each of the 290,000 citations has individuals involved. It has residents involved, it has staff involved, and these are people. And just one example of these 290,000 is at a Michigan nursing home that failed to provide enough staff to meet the needs of residents. And a resident was interviewed and said, for the last couple of weeks, there's only been 2 people there at night. I've had a medical condition, it can be frightening. And this deficiency was one of many that was not cited as harm. This was a sufficient nursing staff violation, and it was cited as E in severity. Now, we, of course, didn't tell the story of all 290,000 citations in this report, but we did look at the overall data, and what we found that citations are rare. They occur for one citation. There's one citation annually for every 13 residents in the 3-year period. Now, that seems low, but even more rare are the harm citations. That is, the citations that are G or above. Of the 290,000 citations, only 5% were categorized as harm. That's the equivalent of 1 in every 260 residents per year. Now, some categories were more likely to be cited than others. For example, infection control accounted for 8% of the deficiencies, whereas staffing accounted for 1% and quality of life accounted for 0.1%. And in New York State, as you might have suspected, and as we suspected, citations are even more rare than compared to other states. So this map, and you'll be able to see this in the report, shows where citations are more likely to occur and less likely to occur. And if you see the darker colors, that is, those are the states that are less likely to record citations. So in the US, there was 1 citation annually for every 13 residents, while in New York State, that was 1 citation for every 50 residents. Across nearly every category, New York ranked at or near the bottom of states. So to conclude this report or this talk is there's often little or no punishment when nursing homes fail to provide care that meet the standards they're paid to achieve. And the government has a promise to ensure that residents are safe and treated with dignity. And by not providing sufficient enforcement and sufficient oversight, they are breaking that promise. We have a series of recommendations that you'll be able to find in the final section of the report, but among the more important ones are that state agencies and regional offices should implement the letter and spirit of the law. We need to develop and implement quality assurance processes to assess patterns of low citation rates and severity, such as the ones that we've identified. And survey frequency needs to increase to 6 to 12 months. It is currently 9 to 15 months. And what you can do in the short term is you can download the guide and report at the link above, which again, we'll post in the chat. And we also have a New York focused brief at the link provided here. And lastly, once you've familiarized yourself with the issues, you can tell your legislators that nursing homes need stronger oversight and enforcement for residents to get the care that they deserve.
Eric and Haley, thank you so much for this kind of good overview and putting like meat on the bones, and just identifying where a number of the problems are specifically in New York State. New York State has a hell of a long way to go, even using its current legislative and regulatory system. You've noted that we're usually at the bottom. That is not a place where New York State should be, ever, for anything. Well, not on the good stuff, but in any event. Also, I wanted to note that we'll take we'll be doing questions towards the end. And given what we've had so far, I hope that everybody will be able to stay with us because we're probably going to go over 1 hour. And there are some very good questions coming in and don't want to miss them. Next, I'd like to bring Sam Brooks up and to get your perspective on this issue.
Great. Thanks, Jack, and thanks to Lindsay, Haley, and Eric for those great presentations. What I wanted to talk about today, well, first, my name is Sam Brooks. I'm a program and policy manager from the National Consumer Voice for Quality Long-Term Care. Consumer Voice is a national organization that advocates on behalf of residents of nursing homes and assisted living facilities. Talking today, I think really what all of this comes down to when we talk about transparency and we talk about staffing and we talk about the want of those things, especially in New York, we're talking about harm to residents. And when these things fail, there's tangible negative results that occur at the facility level and harm residents. So I just wanted to talk about a couple of reports that the Consumer Voice had issued over the past couple of years, focused on staffing, but also during the pandemic as well. I mean, the pandemic laid bare decades-long problems with staffing and infection control procedures, and also transparency. For too long, we've allowed nursing homes to funnel off profits rather than to put it towards care. And really, we saw during the pandemic, especially during when visitation was locked down, how incapable of nursing homes were of providing high quality care due to a loss of staffing. And I think it's this information is, although it's on a federal level, it certainly is applicable. We've seen this across the country, and I'm sure it's applicable in New York as well. So we had the Consumer Voice had issued a couple of reports really focusing on non-COVID related harm to residents. The untold pandemic that certainly over 200,000 residents of long-term care facilities and staff of long-term care facilities have died of COVID. The untold story is the tens of thousands, probably more, that died from neglect and isolation and inadequate staffing. So we became quite concerned about this early on, and we started to look at some information to just try to gauge how residents were doing. We just issued a report in the past couple of weeks, and I'll go into this, about how you can see the negative outcomes just increase significantly during the pandemic as a result of inadequate staffing. And it really confirms the need for staffing standards and the need for transparency, both in New York and on a national level. Touch a little bit about the Biden administration reforms that are somewhat similar to what New York has implemented, except New York's are a little more in the weeds. So I just want to talk a little bit, just give me 1 second. First, touch off a bit about a report we issued last year, January 15th. We surveyed hundreds of family members who were reunited with their loved ones after the pandemic, after visitation restrictions were lifted. We were very concerned that residents had been suffering alone due to inadequate staffing. And the responses we got confirmed that, showing that 85% of families noted a decline in physical abilities, 87% in physical appearance. This was often manifested in long fingernails, unkept hair, and an inability to walk. Residents that were mobile prior to the pandemic were now unable to ambulate or even to get out of bed. 91% reported a decline in mental status, and that was a broad range, but many family members reported being reunited and their loved ones didn't know who they were. If they had cognitive impairments, Prior to the pandemic, they were exacerbated by the isolation. Horrible stories of residents just being stuck alone in their rooms without their glasses, without their teeth, not being fed, and just replete with stories of weight loss and pressure ulcers. Just really horrendous stuff. And almost 7 out of 10 family members responded that there wasn't enough staff. And all of these things, all of these conditions are symptoms of inadequate staffing and short staffing. These things are people not being fed, they're not being repositioned, they're not being interacted with. It really laid bare what it's like when there is inadequate staffing in facilities. Oh, excuse me. So more recently, we took a look at data available from the federal government that it's called the minimum data set. And minimum data set is self-reported data that nursing homes provide to the Centers for Medicare and Medicaid Services. It gauges a variety of resident measures, including, say, diagnosis, weight loss, falls, all kinds of things for residents. There's dozens of measures. This is provided quarterly, and then CMS provides sort of an overview of this data. And when we issued this report, it had only been available up to the second quarter of 2021. More recently, the more recent MDS data is out. One caveat, it is self-reported. It's self-reported by facilities, and it's notorious for not being looked at by CMS. Nevertheless, people use it and rely on it often to inform policy and other situations. The data that we'll go over really show how once families were locked out, because families played an important role that was wrong, but it was vital prior to the pandemic. Families were unpaid staff. Facilities inappropriately relied on families to provide care that facilities should have been providing themselves. And there was kind of a symbiosis here. Maybe family members like to do it, and that's fine. But nevertheless, when those staff, when the facilities were locked down, they lost a major amount of care providers, which were family members. So you really, we'll really see in this data how this the lockdown and the lack of staff really harm residents. Throughout the pandemic, on average, 20% of facilities have been reporting inadequate RN and aid staffs. That number more recently, due to Omicron, was close to 30%. That number is probably much higher, but that is what the MDS data shows. So if you look here, and I apologize, just one got in here by mistake, but if you look at the, this starts in the first quarter of 2018, and you see that peak there, it kind of goes along, and when it starts to rise is when facilities shut down and when family members were no longer there. And it really peaked in the first quarter of 2021 with a huge jump in the number of residents with pressure ulcers. And pressure ulcers, again, result from residents not being repositioned. Residents who aren't able to get out of bed or unable to turn themselves frequently develop pressure ulcers. These pressure ulcers can be deadly if they're not treated. They can become septic and result in significant harm to residents. So you see this climb, it just gradually climbs as time goes on, as one, family members aren't there, and two, there's not enough staff to provide hands-on necessary care. And it starts to decline. Again, if you look at this decline, it starts to coincide really when facilities are opening up again. So they start to have their staff back. And I say that loosely. I mean, they're not really staff, but they're starting to have the families come back in and provide that care. Families are in again. Same with weight loss. I mean, look at these numbers. Percentage of residents with weight loss of 5% or more in the last month, or 10% in the last 6 months. And it just jumps the first quarter of 2021, and then the second quarter, it skyrockets. And again, it starts to go down once facilities reopen and residents are, family members are back in there feeding residents. That's not the solution. Family members are necessary. They should be there all the time, we believe, but that's not the solution. Because that shows what happened when family members walked out, reveals just how important staffing is. Depression. I mean, as you can imagine, the level of depression rose across the board. These are percentage of residents just reporting depressive symptoms. And again, it starts to peter out again as visitation restrictions are removed. And here is one that is very troubling, is the use of antipsychotics. So the percentage of residents receiving at least one dose of antipsychotics in the past week. Antipsychotics are often used, they're sometimes used by facilities to sedate residents who have more care needs, residents that do not have a diagnosis that requires antipsychotics. You should not be treating dementia with antipsychotics. There's a certain discrete group of diagnoses, including schizophrenia and some other diagnoses that these may be appropriate for, but it's illegal and inappropriate to treat residents with antipsychotics just in lieu of providing care. And you see that there was a big jump in the number of residents who did receiving antipsychotics, and it occurred in the second quarter of 2020. And coinciding with that is residents with schizophrenia diagnosis. Facilities often give residents, they'll diagnose a resident with schizophrenia to hide the use of the antipsychotic use, to hide the use of antipsychotics. And either a bunch of people were newly diagnosed with schizophrenia in the second quarter of 2020 or something fishy is going on. People do not develop schizophrenia in their 70s or their 80s. This is a disease that develops in their 20s. So all of these are really symptoms of facilities not having adequate staff. You can read both of these reports at these links, and I'm just happy to be here. And takeaway from this is that the voice of residents must be heard. We've been working at Consumer Voice all month trying to raise the voice of residents. So much gets lost in this and focuses on the facility can't do this, the facility, we don't have enough money, we don't have enough staff. But what gets lost in that is the resident voice. And the residents are the one that are suffering and dying from this. So I encourage everyone to elevate the voice of residents and make them central to any discussion for going forward around reforms. Thanks.
Thank you, Sam. There's so much passion going on from the presenters. We're clearly going to be going over the 1 hour mark, but Lindsay Heckler has to leave, so I've asked her to make a brief response to one of the questions. Lindsay?
So I'm going to respond to what I believe was the first question posed in the chat by Amy Brown, who is wondering for New York experience, what is the best agency to receive and look at the transparency information, DOH, Medicaid, Comptroller, and is there any requirement in the New York legislation that the transparency information be translated into a comprehensive, digestible report, et cetera, for the public or legislature? To answer the first part, I would argue the Department of Health is the best entity. They are in charge of enforcing the minimum standards. They are also in charge of handling the applications for change in ownership. So Department of Health should have already been looking at this information with a usable data set. I can't speak to as to whether they have been, but they should be more seriously incorporating the information into their role, which is enforcement. The Ombudsman program with more funding will be able to use the information they receive in their resident advocacy in trying to resolve concerns. For where this information goes, To my knowledge, both laws do not require a report to the legislature. That could be something in the future, but the Department of Health is tasked with issuing regulations on the implementation of these disclosure laws, and to my knowledge has not yet done so. In the handout, everybody should be able to click on the law to be taken to the Senate or Assembly website with the actual statutes. If anybody has questions or challenges with finding this information, please don't hesitate to reach out. I will put my email and phone number in the chat.
Thank you so much. Now I'd like to be able to move on to Marissa's presentation. Marissa, go for it. We're looking forward.
Hi, thank you for having me. I don't have anything earth-shattering to add because I've been lucky enough to have spoken with many of the presenters prior, and they've helped a lot of the research that I've been doing over the past 2 years. And I'll talk about two things. The first is what related party transactions are and why they're important. And second, how that ties into New York's nursing home profit cap law. So for the first part, a related party transaction, as discussed earlier, is basically where a father owns the nursing home and the son owns the land, for instance, or where the father has one LLC that runs the nursing home and either him or his business partner have another LLC that they contract with for something like linen services or consulting services or nursing staffing services. So there's a lot of different ways that you can look at related party transactions. And as Lindsay mentioned, the Buffalo News and the unions looked into the 2019 data and found that in for-profit nursing homes, specifically 72% of the for-profit nursing homes engaged in some related party transactions. And there's obviously an economy of scales argument where there are valid related party transactions, but the issue is the lack of requirement that there be any fair market value when engaging in these. And there is an abuse and a lot of exploitation in the use of related party transactions for things like consulting and management, which is supposed to be done by the nursing home operator, not serviced out to a third party entity. So I focus specifically on one facility on Long Island, Cold Spring Hills, that's been sort of notorious for related party transactions. And the folks who run Cold Spring Hills have nursing homes throughout New York State. There was 2 business partners that were running the facility, and they are part of the Sentosa Care Network that is the self-proclaimed largest nursing home network in New York State. So while you don't have traditional chain ownership of nursing homes like you would see with a Starbucks, corporation where there's one CEO that has dozens of facilities, with chain ownership of nursing homes, you have a lot of related party transactions with either familiar relationships or common ownership among the LLCs from the nursing home and the different companies that they contract with for services. So that relates to the profit cap law that New York enacted last year as part of the budget, because in part because of these related party transactions, it's making it very difficult for regulators and public analytics to find out whether a nursing home is profitable. So New York enacted a profit cap law that 1, caps nursing home profits at 5%, and 2, mandates that facilities spend a minimum of 7% of their revenue on direct patient care. So not on things like administrative costs in terms of running the facility or consulting fees, but rather making sure that there's CNAs and nursing care for residents, and clean laundry and proper care and things like that. So the state enacted that, and it was supposed to have been enacted this year. And a lawsuit was filed by more than 200 facilities to stop the enactment of it, and alleging that it was unconstitutional because it was taking their profits. And as LTCCC did, some pretty groundbreaking analysis on, they found that there was an extraordinary amount of profits that the facilities would have been making even if the profit cap had been in place. So even if the nursing homes had to spend a minimum of 70% of their revenue on direct patient care, they would still be extraordinarily profitable. And this is already, something that's been delayed several times because of the continuing executive orders postponing this. So this is tremendously important. And I would say that the call to action would be when you're placing a loved one in a nursing home facility to take a really close look, not just at the 5-star ratings, because it's been pretty well documented how nursing homes are able to inflate their ratings. A lot of information on there is self-reported and not always accurate, but to try to take a close look at what related party transactions a facility is engaging with and who is actually providing the services to folks in the facility, because it's not always evident from just the name on the door who's going to be responsible. And the benefit that these related party transactions have is there's a multitude of LLCs that are all performing different operations in a facility, and it makes it very hard to find either the legal person responsible for abusive care or just the deep pocket that should be held liable. And that's sort of the benefit of why these facilities structure their organization this way. So you're not necessarily piercing the corporate veil in the way that you don't know who the owner is. You can find the owner, but it takes foiling the cost report from the Department of Health and then trying to track down the relationships among all of these different LLCs to see who the exact owner is. So I would say the call to action would be just to pay, very close care in a facility and, to support proposals both statewide and federally that shine a closer light on regulations for related party transactions and prohibiting their use in certain instances.
Thank you. That is a deep dive into what some of the impediments are. And Marissa, what you did for us is you also showed that even if, one of the things that I'm taking away from your presentation, even if all of these new statutes are enacted and there's a cap on profits, there's still a hell of a whole lot of money to be made. So it's not about care, it's not about profit, it's about greed. So, that's kind of what we had set out to talk about during this webinar. I'm going to ask, because we're coming up to the 1 hour mark, and we're obviously going to be going over, but I wanted to address some of the questions that have been raised in the chat. And the first, Sam, would you be so kind as to answer one of the questions that was in the chat?
Was there a particular one in the chat? I'm sorry, I had to log off and I lost all the questions.
All right, then for the moment, let's go to Haley.
Sorry
Yeah,
about that.
thanks. I was going to address Arthur's question. It's about the nursing home is intent on making money. Can the nursing home industry be reformed, or do we need new models of care? And what I will say to that is LTCCC would really like to see New York's direct care minimum spending ratio law be implemented. We can put a link to our latest policy brief about that, which goes into more detail, but that law requires the state's nursing homes to spend a certain amount of money on direct resident care. And it also limits the nursing homes what they spend on other categories of expenses. Implementation of this law would really help to ensure transparency and accountability. As for other models of nursing home care, LTCCC is actually currently working on some research, and we hope to soon publish a brief on the different models of culture change. So culture change is a movement seeking to transform nursing homes from institutional medical settings into more home-like settings. So it's more of a home for residents. We are looking at the different models of culture change and the benefits of each. And again, we hope to have something published very soon, but I can't speak more to that just yet.
Okay, I'm trying to, let's go to Marissa. Marissa, is there any of the questions in the chat that you would like to address? And we're looking forward to whatever you might provide.
I don't see anything specifically, unless somebody has one.
Is there, okay, people who have already made questions or comments in the chat, if you would like to make a question now, I would appreciate it.
Recap.
Hello? Any of our participants? Hold on one second. Oh, why don't we start with, well, I'm going to ask Margaret. You did have a couple of questions. Just so you know, Margaret had been on our panel last month, which was ageism in nursing homes. So Margaret, can you ask your question?
Yes, I just want to say, I wish other states had Grey Panthers doing this kind of informational, having experts who can explain things to the public. And my question was, do any of the panelists care to comment on what is missing from Biden's plan? Somebody already said, well, you know, we're not getting the data or the details that we need about Biden's plan, but maybe you already know what you think is missing.
Who would like to make a comment on that? That might be a Sam question.
That's a very good question.
Sure, I think, to be frank, I think it's pretty early. To be honest with you, when we saw the announcement, we were in a state of shock. These are all issues that all of us advocates on this call have been fighting for, some people for decades. And the list was quite comprehensive, and really much more than we could ever imagine. However, as folks say, it's in the details, and it's really too early to tell just how broad some of these reforms will be. Nevertheless, we believe the framework is there to build in some of the most significant and important protections for nursing homes residents in decades. But again, the details are lacking. We were happy, that this was announced, that he even mentioned nursing homes in the State of the Union, something that never happens. But the next steps are making sure that all of these provisions are implemented, and they're all implemented in their most beneficial way to nursing home residents.
Well, thank you.
I have another question, which is, again, it's speculative. The state of Washington has not implemented, but has passed a law that about long-term care insurance, in which all workers could participate. Would any of you like to comment on that plan? As you know, it's been because of suits against it, or maybe you don't know, but because of suits against it, it hasn't been implemented. They plan to implement it. It's still got a program office and a head. Any comments about long-term care insurance? It would, I believe, have to be national.
That might be a question for Eric or Haley.
It's not. I think it's not in my expertise. At least I don't think I could give you a comprehensive answer on that.
What you're saying right now means that the reason that we're on this call together is all of us on this call together are understanding how much needs to be changed. And we need to band together and start slapping the policymakers so that we raise our voices together. It has not been adequate. Our voices have not been adequately loud enough. We now have this opportunity with all the stuff going on in New York State, as well as with the White House Biden plan, or to come together. And, you know, all of us on this call, as well as others, many others, need to stop being so nice.
Yeah.
Who said that? Who said that we shouldn't be so nice? Which is, so what other questions from people on the call do we have? There was another question from Art, talking about how much money. Anybody know how much? Can any of the panelists say how much money U.S. taxpayers pour into the pockets of nursing home industry via Medicare and Medicaid to nursing homes with deadly and dismal results? Do you have a figure on that, on how many billions there are?
Looks like I'm just pulling this up. In 2019, Medicare paid nursing homes $27.8 billion in 2019.
And that's just Medicare.
Right.
That's not even Medicaid.
I don't have
So-
a figure, but it's about 70% of the money that nursing homes receive is from Medicare and Medicaid.
That is an enormous sum of money. And the quality that we're getting for that, or that the individuals are getting, sometimes it's fantastic. But how many times have all of us on this call spoken to the family member of someone who's in a nursing home, and they are beyond furious because the quality of care that their loved one is receiving is just really crap? Just about everybody on this call will have had that experience. So I think that we've had a very robust conversation. And I'm really grateful that everybody's been able to stay on as long as they have. We've had a good turnout. And, let us band together to work on these issues. We got stuff ahead of us. We have New York State, we have White House, and we have the thing that has not really been addressed is transformation. It's not that these things aren't only about tinkering with the current system, but the current system's got to go. It was never good, and COVID has shown us that it's been never good and that it needs to be overhauled. But I just want to hold on. Let me look at some of these messages. Art's number was how many nursing home residents have died. And I believe that was already mentioned, over 200,000 in long-term care facilities. And then I believe, was it Haley or Sam that said additional tens of thousands that died from inadequate care. So
Yeah, the AP, just to touch on that, the AP did a report that in the months from March 2020 to I think November 2020, there were 40,000 excess deaths in nursing homes compared to the year before, and those weren't from COVID. And that's just that stops before when COVID hit its worst in nursing homes. So that's just in a 5 or 6 month period, and so that's a story we'll never know. Anyway,
let us all band together. Gray Panthers we want to make an effective change for people who do have voice, but inadequate voice. And I just wanted to say thank you to everybody who's been here today. I think that this has been enlightening with a lot of facts and figures and a lot of passion behind it. So thank you very much to all of our presenters and to all of the questions, and the fact that everybody basically stayed on for the entire session. God bless you all. And we'll be sending out thank yous and some of the materials. All right.
Bye there.
Bye-bye.